everybody.
Darren Stern II.
And I am Reese. On April 23rd, 2021, our son Darren Joseph Stern III, he was 2 months old, and he was rushed into the emergency room because he was unconscious and
Not responsive.
and he was drooling out of the mouth a little bit. So they rushed him to the hospital, and they had to hurry up and put a tube inside of him to help him breathe. So just a little backstory on his 2 months of living. I was breastfeeding him, and I stopped lactating as much as I was when I first started feeding him. So we wanted to try natural supplement milks. So we tried like banana milks, oat milks, hemp milks, and I had a rough birthing experience with my doctor. So we wanted to switch hospitals for his pediatrician. So we were in the midst of finding a more holistic pediatrician for him, and I was still feeding him from me, and then whenever he wouldn't get full, we would give him a couple ounces of the milk, and we wanted to see what he responded to, what he liked, what he didn't like. He was starting to get heavier, he was starting to get longer. He went from preemie clothes to newborn clothes to 0 to 3 months. We had a baby scale at the house, and we were weighing him, and he was gaining weight.
We were just on our way to start the 3 to 6 months because it's getting too long for the 0 to 3 months. So it's clear he was growing. You can feel it. He didn't look as if he was getting wider, but he's coming from a line of men that we don't gain too much weight. We grow up, not out. And I've always struggled to gain weight and maintain weight. Even at my peak of, I was an athlete in school. I could not maintain weight. I couldn't.
And I had him at 36 weeks, and he was only 5 pounds and 7 ounces. So he went to a hospital in Indiana, St. Catherine, and we were there for a couple of days, and they sent us home. So once he got admitted back to St. Catherine when he was unconscious, they had to hurry up and transport him here. And the first question everybody was asking us was, did he go to the NICU when he was born, as if that was something that...
That's the newborn intensive care unit, right?
Yes.
Okay.
So when we got here, his blood sugar had dropped extremely low, which was the reason that he was unconscious. He had a breathing tube down his throat, and they were giving him oxygen. They were giving him different types of pain medications and antibiotics to fight out infection, because when he left the hospital in Indiana, they didn't do any blood cultures, so there wasn't...
They had no test results when he arrived here. So everything that they needed to know about or find out about, they had to do on the spot.
So he ended up getting the tube down his throat, and his airways were a little small, and he got...
They had some trouble. They eventually did get the ventilator tube in his throat. You can see and you could tell it was uncomfortable. Every now and then he would suck on it. He would look like he was trying to push it out his mouth. He would kind of squirm a little bit. So it was obvious. He wasn't as comfortable as he could have been. We did let the doctors know, and they did take action to help him feel more comfortable. A lot of that comfortability came with sedation. So we didn't really want to do too much sedating because he was already on a set schedule with I think 2 different sedation medicines. It was fentanyl and what else? Albumin?
Yeah.
Fentanyl and albumin. Fentanyl was to stop the seizures, which when we got here, we did find out he had 2 seizures.
Can't breath.
Keppra. I'm sorry, not albumin. Keppra and fentanyl were the sedation medicines. The Keppra was for the seizures. We got here and found out he did have 2 seizures when we arrived, and they ended up having their neurology team hook him up to an EEG machine to monitor his brain waves, what was going on, see about the seizures. They kept an eye on him 24/7. They even gave us an alarm button to hit just to make sure if we saw something and they didn't, to make sure they would zoom in or pay attention to see what was going on. The EEG just showed what looked like a heart rate monitor, but it was set up to different brain waves. And they had to put several stickers on his head and wrap his head up so he wouldn't fidget and twitch and move around and loosen them.
We came back from the cafeteria and there was a ton of nurses in here and they were all like scrambling around, and they let us know that he would have to go on to emergency surgery because when they were putting the tube in, they ended up tearing a piece of his stomach.
They had to give him a feeding tube because of one of the medicines they couldn't feed him. They couldn't have anything in his stomach. So they were setting up a feeding tube to go straight into his intestines. And as they did that, they caused a rupture in his, I think he said lower duodenum, the lower duodenum of his intestines, which is the beginning of the intestine right outside the stomach, which caused a lot of seepage and leakage internally. So they had to rush him to surgery. They ended up having to make an incision in his lower right side of his abdomen to suction and clean out everything that had seeped out, and then they had to close the hole up.
And stick a drainage bag in it.
And he had to get a drainage bag.
So they try to say a lot of that came from something that we did, other than the fact of them actually putting that tube down his throat a little too far and causing a rupture. So he would have to get images done for him throughout the days, and one day he had a transport team with a couple of sedation nurses, and on his way back we heard like a really big boom.
Before that, he had went for his first MRI, and he came back with blood in his urine. You could see it clearly in the drainage bag that he had received from the previous transportation team. So that's within 3 days.
And then he went for the MRA,
which was the day after, right? The day after the MRI.
Yeah, the day after. And we were sitting here and they were bringing him back, and we heard like a really, really big boom.
And we have a picture window in our room where we can see directly outside, and it's like a nurse's desk right in front of us. So as our nurse was walking up, we heard the boom, and I was looking out the window already, and you can see our nurse gasp and like shock, because whatever that was, it was clearly loud because our doors are closed, and we could hear it in the room.
We heard the team that was transporting him
laughing.
They just started laughing. So when they got in here, they started pulling really roughly on his cords, and a lot of his cords were getting stuck in his foot because they were already all tangled up. And then
she asked them politely,
"Can you guys stop pulling on his cord? Can you guys
slow down?
Be a little careful?" And she replied with, "He can't feel it anyway."
But she tried to whisper it under her breath
and say it to another nurse, and we heard her.
Right.
And
I spoke up. Of course, they're all co-workers and employees, so they stick up for their co-workers. The other 2 nurses tried to deny it. We already had another
problem with 2 other nurses, and they were working on him, and one of the nurses was moving too fast, and they grabbed the IV that was in his hand
and ended up snatching it out.
Snatched it. And a couple hours later, his hand was puffy, and
swollen.
They had to take the IV completely out. As well, we said something about that. They tried to say that had nothing to do with anything, but his hand was perfectly fine, and his IV was running fluids great before the pulling happened.
On top of, they didn't update the next nurses because the next nurses came in and asked what happened to his IV. He had an IV in each hand. Both got removed. Both were not Neither were noted and passed on to the next nurses.
And we had to ask them, we heard a boom out there. What was that? Is everything okay? And that's when one of the nurses was like, well, we ran his baby bed into the wall. So nobody told us. We actually had to ask. And if we wouldn't have been up here, we would have never even knew what happened because apparently nobody was talking to us about it. He had another nurse that I also had to fire because she was as well pulling on his cords very roughly. I asked her not to do that. She turned around and got very irritated and turned back around and got more aggressive with him. So I said, you're still pulling on his cords. And she said, well, I'm going to be here until 7. So after that, you don't have to see my face anymore. Was her response to me when I asked her to stop pulling on his cords.
Rather than comforting her and reassuring her, your baby that is in this hospital that we're supposed to be taking care of is in good hands. Her response was aggressive.
And then
and
she slammed his baby bed back up and got his cords stuck into the bed and had his suctioning tube wrapped under his back. So his daddy had to go and fix the cords and grab it from under him. I said something to the other nurse about how I was reacting, and all they had to tell me was how great of a nurse she was and how long she had been here. Like, I honestly didn't care about that because it doesn't matter how long you've been here. It doesn't matter the experience that you have. This is a totally different baby that's in this bed, and she definitely was not treating this baby as if it was her baby that was in this bed or somebody that she was related to in this bed. So,
we spoke up about each situation. The first situation with the sedation team running him into the wall, we ended up speaking to their manager.
And she never came back.
She was supposed to be giving us a follow-up of after she had spoke with her team. We haven't seen her since. This was last week. We spoke to
the PICU nurse never came to speak to us about the event with the nurses pulling on him.
We spoke to one of the higher-up nurses, like I guess the nurse right above them, but we never actually spoke to a manager or a supervisor of this unit.
And
or
they told
this
us
floor.
that she would be coming to speak to us about the situation because we've already had to fire about
several nurses.
seven or 8 nurses, and we've only been here for 12 days now.
And this is our second day waiting on the supervisor of this unit. We were supposed to talk to her yesterday morning. We never heard from her.
And his machine was going off because his oxygen was getting kind of low. And the nurse that we fired, she was sitting out there talking to another nurse. And his daddy had to go out there and let him know, like, the machine is beeping. And she was like, yeah, we're aware.
Yes, her response was, we're aware. We're watching it on the screen right now.
They didn't move. They didn't come to turn it on. They didn't come to check on him. And he was crying. He wouldn't stop crying. And we found out that
they gave us an alert button.
The bed under the covers under him were wet, so she hadn't came in here to check up on him to see if he was okay. The whole time he was laying in pee,
He had pee
which
through
was his
diaper,
biggest problem.
and it soaked into all of his sheets and blankets that he's wrapped up in. So we eventually got tired of it. I hit the emergency button, and she finally did show up a few minutes after I hit the emergency button. She ended up changing him. We were explaining to her, it wasn't a good few days.
And we also got a DCFS investigation opened up on us.
Our second day here?
Yes, so the lady came and talked to us, and I answered all of her questions about how I was feeding him, what was going on, and when the guy came out to talk to us in the report, she totally
ignored
said
everything.
She didn't say nothing that I said. She told them that I had stopped breastfeeding him, and he was exclusively on bottles. I have pictures of him eating up until the day that he got into the hospital.
Just about every picture we have is him eating.
I've never stopped breastfeeding him. He's been breastfeeding for me from the day he was born to the day he got into the hospital. The ounces were just supplement to help me if he needed more after me, but he always ate for me. She put in the report that the daddy didn't have a say-so in me going natural.
We both chose to go natural.
So
I had a part in picking one of the supplements we chose. On top of, I eventually was the one making the supplements.
So I have a spinal cord injury, and I was in the ICU for 46 days and rehab for 36 days. And by the time I left rehab, I was addicted to opioids, and I had to go through a very huge withdrawal stage after getting off of all of those different pills. So when it came to formulas and modern medicines, I wanted to go the natural route with my baby because I saw a lot of my siblings' babies. They tried them on different formulas, and I saw what it did to their stomach. I saw the health problems that it was giving them. So I wanted to go the natural route.
And it caused us to do our research, of course, before we just jumped into anything.
We talked to people who were doing those other natural formulas. We watched videos. We read about the different, the calcium, the protein, and everything that came with these milks. Everything that would be supplemented, everything that he would be getting. So it's not like we were just giving him these milks. So today is currently day 12, and he got the breathing tube out yesterday, and he
got his stomach drain out this morning.
Yes. He has been up all night because they currently took him off the fentanyl, and now he's going through withdrawals. So he would go to sleep, then wake up and be in a panic.
Not even 10 seconds later.
He would cry. He would be very scared of touch, anything, any loud noise. He could not sleep. So from 11 p.m. to 7 a.m., he's been doing this. They let us know.
Before 11. It started at 9.
Oh, yeah, that actually started at
9:30.
They let us know that this was because he was withdrawing from the drug, that something like this would happen. They took him from 1 ml to 0.8 in a matter of that one day, and his body kind of went into a shock, and his vitals were going down, his heart rate, his oxygen. But they honestly just basically let us know that there was nothing we could do. We just had to sit here and watch our baby cry and go through this and struggle to breathe and struggle to sleep.
And to speak back on the case filed against us, the report made it seem as if we were just neglecting our child, as if like we just didn't care.
And
but
they
that's
put in the
obviously
report
not the case.
They don't know how the hole got into his stomach.
Oh yes, they initially tried to let us take the blame for the rupture in his intestine, and they tried to say it was mostly due to malnutrition. But we weren't. Like we were feeding him. He ate constantly. When he was awake, he was eating. They tried to say we weren't feeding him, but we were eating good, and that was actually pointed out in the report. The child looked malnourished, but the parents did not, and that was specified early in the report. So, I had to ask the representative for DCFS, like, where did that come from? Because once it happened, the doctors did eventually come and tell us, hey, we had to put a stomach drain in because we ruptured his intestine. It's due to stress or friction from the tubes going in and out, them having to take it out and replace it. And even as he was explaining to us what happened, he was talking as if like he was trying to take less of the blame and put a lot more of the blame on us, because he would constantly say, well, he's malnourished, so it was already, I'm pretty sure it was probably already thin, and then we just made it worse with the tube. But even if we did, and we did not, because we had proof, like we feed him constantly, we fed him constantly, he never missed a meal.
We have videos of making
videos, pictures,
he's
everything.
Always attached to me. He's always eating for me. There's never been a day where he hasn't ate from me.
The only time
he only starts with me.
The only way we really would get him to sleep is after he ate from her first, and most times he would fall asleep on her breast. We wouldn't even get to burp him. We would have to wake him up and burp him, or we would have to just burp him when he woke up. And he was on a feeding
schedule, so he was waking up every hour and a half, every 2 hours to eat.
Right.
And I was drinking different lactating milks and eating different lactating foods to make sure that my breast did fill up with milk.
But
And
I didn't understand how we could be the blame for that. Like I say, they want to blame us for neglect and keeping him malnourished, but being malnourished isn't gonna put a hole in any organ in your body. Something has to be in there to put a hole in something. For
hold on,
me,
baby, his doctor. Yeah.
come on, that doesn't make sense to me.